Go for it.
Alright, so now again we're going to review the cranial nerves. So again we're looking at the inferior aspect of the ventral side of the brain. So first we have cranial nerve 1, olfactory nerves, okay, which run through the olfactory sulcus. Okay. Cranial nerve 2, optic nerve, of course leaves the eye and then comes together at the optic chiasm and then leaves its optic tracts. So again, cranial nerve 2. Of course we cut cranial nerve 2. Okay. Next we come down and look at cranial nerve 3, oculomotor nerve. Okay. And again we said it runs between the posterior cerebral arteries and the superior cerebellar arteries. Okay. Cranial nerve 4, trochlear nerve, usually is lateral to cranial nerve 3. And unfortunately in this specimen we don't see it, but they usually be located here, just lateral to oculomotor nerve of cranial nerve 3. Okay. Alright, now we would move down. Cranial nerve 5, the trigeminal nerve, usually would be located here in our larger nerves. Unfortunately, we don't see it on this specimen. They would be located here. And cranial nerve 6, abducens nerve, again, it's usually more medial, comes out more midline, inferior to oculomotor nerve 3, and they usually come out here. We don't see it on this specimen. They would be located here. Okay. Now cranial nerve 7 and 8, facial nerve and vestibulocochlear nerve. We actually see the nerve fibers here. Okay. So again, 7 and 8, facial nerve and the vestibulocochlear nerve. Okay. So we see fibers there, nerve fibers there, and nerve fibers there.
7. No, 7 and 8.
Yes, sir. That's what I said, right?
No, you said 5.
Did I?
Yeah.
Okay. So again, cranial nerve 7 and 8, facial nerve and vestibulocochlear nerve. Okay. And as we move down, now we look at cranial nerves 9 and 10. So here we have cranial nerve 9, glossopharyngeal nerve, cranial nerve 10, vagus nerve. See them on this side as well. Glossopharyngeal nerve, vagus nerve. Okay. And moving just inferior to that, we have the spinal accessory nerve. Fibers would be here. Okay. And lastly, we have cranial nerve 12, hypoglossal nerve, which usually is medial to the olive, so it would be here, and lateral to the decussation, which is here. So it would be right along here. You can see some fibers. Right there. Okay.